Yeah. My name is Jessica Martin. I'm an ABN student at Williston State College. Today I'm demonstrating my week 5 skills, which are an IV medication push and an IV bolus administration. So I have been in with my patient. We verified her name, date of birth, and her allergies. I did a pain assessment on her, and she's at a 9 out of 10 right now, and her labs show that she's hypokalemic. So I just received some new orders from the doctor. 0.9 normal saline, 250 ml with 20 milliequivalents potassium chloride IV at 125 ml per hour. And morphine sulfate 4 mg IV push every 2 hours PRN for pain. So after my dimensional analysis, I know that I will be giving 10 mL of potassium chloride in my normal saline, and I'll be giving 0.4 mL of morphine. So I am in my medication room. I'm going to do hand hygiene, and I have my gloves. I'm going to put my gloves on. And we're going to start with the morphine. So here I have my morphine bottle. I'm going to check the expiration date. I'm going to check the integrity of the bottle. That is all good. We're going to clean it. In practice, we clean it for 30 seconds, and then let it dry. Demo purposes, we're going quicker than that. Okay, so while that dries, we are going to get our needle. Okay. And our cap. So I'm going to pull out 0.4 mL of air. My hub is dry, so I am injecting in here, and I'm going to inject my air, and now I'm going to withdraw my 0.4. Have some air bubbles in there with my no. Oh, okay. That's good thing. Alright, so I'm just going to get the air bubbles out, and I verify with second nurse that we are at 0.4 mL. Okay? And then I'd also, before that, I personally would have the nurse check my dimensional analysis, and it is correct. This morphine vial will go with me into the room. Okay. So now what I'm going to do, oh, there's my phone. Okay, so I would change my gloves after that and do hand hygiene again and put new gloves on. So anyway, now I'm going to dilute my morphine in 1 ml of normal saline. Okay. Let's see, and the total volume inside my syringe will be 1.4. And I did not touch that with my glove. I need to not to. Okay. And that is at 1.4. So I'm going to use my needle. I'm disposing of my needle in my sharps container, and this can be disposed of in there. So now I'm just going to put a cap on this to keep the end clean during transport. It's hot here. Okay, so I'm just going to write my client information, the drug, the amount, and the rest of the information, and we're going to label this right there, below the plunger, put the plunger there, so we can still see where our dose is at. So, that was the first med check for morphine. Now I'm going to do my first med check for the potassium. I verified my 6 rights, expiration, integrity of the bottle. For the morphine, now I'm doing the same, my 6 rights, potassium chloride. I'm making sure the bottle has no compromised integrity and the expiration date's good. So now I am trying to make sure I don't overrun my time. Alright, so that's going to dry for 30 seconds. And while that dries, I'm going to get this ready. Okay. So again, 10 mils of potassium. I'm going to withdraw that much air. Okay, that's dry. So we're going to inject the 10 mLs of air. Okay, and now we are withdrawing. Okay, and this demo bottle has been very used, which is why it's leaking. In real practice, we would not use a bottle that is leaking so much, or leaking at all, I mean. Okay, we're at 10 right there. And then we're air bubbles. Okay. Alright, so now I'm going to do first med check for my normal saline, and going to open my package. I'm inspecting the integrity of the package, making sure there's no discoloration, power position at the end there, it's not wet, nothing like that. So, what I'm going to do now is I have to double check that. I'm going to clean this port for 30 seconds, we'll let it dry. And we are going to inject the potassium into our normal saline. We're going straight in and making sure not to poke a hole through the bag. Okay, perfect. This comes out. Here, and straps left right here. Now we're going to gently mix it until all the medication is mixed together. Okay, back and forth, and going to label it with our potassium medication label, and we're going to label it with one of the patient's identification labels with their information on it. There we go. All right. So before I leave the room, I am in this way. This goes with me, and I'm doing my second medication check. So I'm verifying my 6 rights for my morphine, and everything checks out. I'm verifying it for the potassium that checks out, and I'm also verifying my 6 rights for my normal saline. Checks out. I've already checked that potassium chloride and normal saline are compatible for each other. So I'm ready to take this all to the patient's room. Alright, knock knock. Hello Shirley, I'm back. Like I said earlier, Jessica, you're your nursing student for today. And when I left the MAR, before I left, I disposed of my gloves and did hand hygiene. So I'm back in the room, got done hand hygiene, introduced myself again. And Shirley, can I get your name and date of birth, please? I check her identification bracelet and allergy. It's been coding. I see that all is correct. And drop privacy. And again, we did hand hygiene and got brand new gloves on. Okay, Shirley, so I've got a couple medications for you from our doctor today. Got some new orders, got some morphine for you for your pain level. And we also have some potassium. So the potassium is for your potassium levels, because they're a little bit low today. So do you have any questions or concerns about that? No, she doesn't. So what we're going to do first is I'm going to inspect the IV site. I'm looking to see if nothing seems abnormal or wrong with that. So the first what we need to do is clean the port for 30 seconds. Let it dry. Again, for demo purposes, we're not going that long. So I'm going to be aspirating for blood. And here, let me show the breath. We're going to be aspirating for blood and then infusing this to make sure the line is patent. There we go. I'm doing the luck. And I'm watching for any swelling, infiltration. Shirley told me if you have any pain when I do this. Okay, she says no. And oops. And before that, I would have aspirated for blood and then done my flush. So we're putting another lock again, taking off our empty syringe. All right, so here we have our morphine and the bottle. So I'd scan the bracelet, scan the bottle, and I'm doing my check against the MAR. I verify my 6 rights for my 3rd check. So I see that everything is correct and checks out. So that means I'm going to clean the port again for 30 seconds, let it dry, and take off my cap. Okay, so for morphine, for this dose, we are going to administer it over a course of about 2 minutes. However, for the sake of demonstration purposes, we're going faster than that. But we know that it'd be over the course of 2 minutes to prevent any patient discomfort or harm. So I'm locking that back up. Take this out. This goes in the straps because it had morphine in it. So we are cleaning the port again for 30 seconds and allowing it to dry. And we're going to do another flush to get all that medication out of the line. Shirley, are you having any pain or discomfort from that specifically? No. Okay, and that should be helping your pain level pretty soon. So we are doing another flush. And this whole time I'm inspecting the IV site. And while I prepare my next step of this skill, this gives me a chance to also monitor her respirations for any respiratory depression that would indicate that we need to reverse the effects of the opioid, and that would be administering naloxone. So I will be monitoring her respirations while we do this next part. So I would change my gloves, do hand hygiene because I just touched my hair, and our next part here, do our 3rd med check for our potassium and our normal saline. So I verify my 6 rights, and they all check out. So now what I'm going to do is get out my AV line. Okay, so this has a cap on it, and this has a cap on it, which means we do not need to clean either end as long as we don't touch them to anything. Take them off, and I'm going to spike my bag. All right, perfect. Now we're going to hang our IV bag, and now we need to prime our line. We're going to fill our drip chamber about halfway, and getting our air out of our line. we're getting our air out of the line. Alright, we have done that. Ensuring there's no air bubbles in the line. I'm going to close this back up with our lock here. And because I touched the end of this, I'm going to sanitize it with an alcohol wipe and then put the cap back on and do the next part. So, go ahead, just want to move that higher up. Okay, so Shirley, we are going to clean your port again. And if we hadn't given the medication and done several flushes and done the most previous flush, we would be aspirating and flushing again. But since we did that, we're not going to do that over again. So I have this. We are going to hook this up. Just clean it. Undoing your lock. We are putting this cassette into our IV pump. Okay, come on, there you go. I'm doing this, and I am setting the administration rate for 125 mils per hour for 2 hours for a total volume infusion of 250 mils. So Shirley, and that is, again, programmed and started and going. Shirley, I'll be back in about 2 hours, and if you just want to press your call light, if the button goes off, if the beeping starts before I get here. So I am also going to be back in about 30 minutes to reassess her pain. Her respiratory rate is within normal limits and fine. Okay, right. You don't need that cap anymore, I guess. So, okay, Shirley, if everything's good and again the IV line looks fine, I'm going to make sure she has her call light, remove my gloves, do hand hygiene, and remove privacy, and I'll be back 30 minutes to reassess. When I go back to the bedroom, I'm going to either put this in the sharps if it's empty, or I'm going to get a second nurse as my witness, and we will waste it, draw without draw it, and waste it properly, and put this in the sharps. So we're going to say that is done, and it's 2 hours later, and I am back. Okay, Shirley, do hand hygiene, put on brand new gloves, and get your name and date of birth, and your allergies, okay? We do both. All right, so I'm just looking at the IV site. We've already assessed her pain after that 30-minute mark, and it was at 3 out of 10, so that's good. That's within her acceptable pain rate. So I'm just going to see how much the correct amount was infused, and it was. So I'm going to stop the infusion, and right here, 2. All right, Shirley, so I'm just going to take a look here. All right, so we are going to take this tubing out, hang it up here for later use, and we just need to do a quick flush to get all that medication out of the line. So we're going to clean this for 30 seconds, let it dry, and then we do another 3 ml flush. And that would have been locked, and now I'm unlocking it. So we are flushing it, 3 mils, watching for infiltration. She's going to tell me if she's in pain from that. Okay, so now we are locking this and disconnecting from the port. Okay, Shirley, if you have any more concerns or questions, she says no, then I'm going to remove my gloves and do hand hygiene. I will tell her, Shirley, if you need anything, please use your call light and let me know. Give her her call light, remove the privacy, make sure the bed's low unlocked, and I'm going to collect my supplies and take all my supplies out of the room. And when I go back to the MAR, I will document how much of the IV fluids were infused, what the site was looking like, what type of IV fluids were given, And earlier, after I gave those meds, I'd have documented what med, the dose, the route, the time, and any adverse effects. I would document the location and that I properly disposed of the morphine and anything else per facility protocol. That's the end of my skill.